Hi, this is Michelle from Bright Star. I'm here to talk to you today about multiple sclerosis, or MS. MS is a disease of the central nervous system, meaning the brain and the spinal cord. In the morning when you go to pick up your cup of coffee, your brain sends a signal to those muscles to pick up that cup of coffee. Someone with MS, those signals are interrupted, meaning the muscles don't work like they used to. It's a progressive disease, which means it gets worse over time. There are several risk factors, meaning there are several factors that can increase your risk of getting multiple sclerosis. That can be genetics, environmental factors. It's an autoimmune disease, means the body attacks itself. Women are more likely than men to develop the disease, and it can occur anywhere from teenage years to 50s and 60s. There are several symptoms of multiple sclerosis, and they can vary vastly depending on the progression of the disease, but there can be visual disturbances such as blurred vision, pain in the eyes, also can have coordination problems, meaning stumbling, clumsiness, anywhere to complete immobility. There can be weakness in the muscles, and fatigue, slurred speech, spasticity of the muscles. And these symptoms can vary widely. There's bowel and bladder changes and mental changes such as confusion and difficulty concentrating. The diagnosis for MS is sometimes difficult. It can be done through a complete history and physical, mostly the symptoms, the history of your symptoms. Doctor may also perform an MRI and nerve function tests to diagnose the disease. Treatment is aimed at mostly symptomatic. It's important to get proper rest and nutrition, but your doctor may also prescribe physical therapy and occupational therapy to help with some of the symptoms and manage those well. There's several resources available. The Multiple Sclerosis Society can be very helpful in finding resources for you and assistance. Again, it's a disease with a lot of hope for therapies in the future. There's a lot of medications out there. There's no cure for MS, but there's a lot of medications that can help with the symptoms, and it can be very debilitating. And again, it's a progressive disease, so it can get worse over time. But we are hopeful that there's medications and therapies in the horizon to help. Thank you for your time today.